Welcome to dentalxp.com. I'm Dr. Maurice Salama, and today we're going to be taking you through a soft tissue grafting procedure in the maxillary left posterior quadrant in the area of tooth number 14, the maxillary left first molar. Significant recession on the labial aspect, particular to the mesial root of that molar, mesial labial root. And we're going to utilize an alternative technique, a lateral pedicle graft. So rather than having to harvest soft tissue from a secondary donor site, we're going to utilize blood-borne bioactive materials, in this case PRF, plasma-rich fibrin, and we're going to utilize a lateral pedicle approach where we will rotate the flap from the distal aspect and move it mesially. We have an implant already in the area of the second bicuspid, so we want to leave that area alone. And we're raising the flap full thickness to the mucogingival junction and then partial thickness beyond there. Vertical incision and cutback incision is made distal to the second molar to allow for release of the flap, and that's what we're doing here, beyond the mucogingival junction in the elastin fibers of the mucosa. You can see here that we're testing the mobility of the flap and making sure that we can rotate that flap. And at this time, we're cleaning the wound margins so that we can have a butt joint or a stable closure, flat edge to flat edge at the end of the procedure. Once again, testing the mobility of the flap, which is so very important with a lateral pedicle approach. And we're now going to plane the root to remove any mechanical debridement, if you wish, to remove any bacteria or any debris that is remaining on the root surface. This allows us to expose the smear layer of the dentinal tubules and the cementum, and now we're placing tetracycline, in this case mixed with lidocaine, and we leave it on for 3 minutes for root conditioning. This allows us to open the dentinal tubules, it also disinfects the root, and it also recruits fibroblasts for future healing. We're now utilizing the liquid form of the PRF material, in this case, from Intralock, and applying it to the root surface. My assistant during this procedure is procuring the PRF, or the blood-borne bioactive materials that was harvested from the patient's own blood, and creating fibrin. And we're going to utilize these prefabricated autologous fibrins as multiple layers of autogenous growth factors placed over the root surface to enhance the wound healing. So this is being used in lieu of an autogenous graft taken from the palate or utilizing ACDM. We're also utilizing 6.0 PTFE sutures from Omnia. This is an excellent suture with a end cutting needle, small enough for us to work in this environment. Also, because it's polytetrafluoroethylene, this allows us to retain the sutures in place for a number of weeks. We're going to suture the mesial horizontal vertical incision first and make sure that we engage the margins of the wound and the wound edges for suture closure. Only after we secure the mesial vertical incision with the lateral pedicle, we then utilize a vertical sling mattress suture utilizing the back aspect of the molar to compress the flap and move it vertically over the PRF fibrins that were placed underneath the soft tissue. This allows us to compress the flap, but also to coronally advance the flap over the exposed root surface. These sutures are very, very nice to utilize. They allow us to tighten on the second pass, and this allows us versatility during the suturing aspect. Once this is done, we close the remaining parts of the vertical incision on the mesial aspect, and we leave the distal aspect in partial thickness dissection. We leave that to granulate in. There's nothing that needs to be done distally. That area will granulate in and we will get excellent wound healing. So here you can see the final sutures being applied to the vertical incision on the mesial aspect, and then one additional suture being placed on the distal aspect of the molar to advance the flap. You can see we have very nice closure at this point over the previously exposed root surface. And these sutures, again, 6-0, PTFE or polytetrafluoroethylene sutures. They don't really allow for any wicking, and they can be left for a period of time. Here you can see post-operatively, the day of surgery, we were able to advance and mobilize the flap and move this flap mesially as a lateral pedicle. This is early healing at the time of suture removal, and you can see excellent early healing with some swelling still remaining. And then at 3 months post-op, you can see an excellent result over the previously exposed mesial root surface with healthy tissue without the utilization of a secondary donor site, utilizing a combination of lateral pedicle flap as well as plasma-rich fibrin, PRF, as a graft material. I hope this has given you an idea of an alternative design to soft tissue augmentation, as it allows for the avoidance of a secondary surgical wound, and it optimizes the vascularity to the flap by retaining its position and attachment to the tissue and the underlying periosteum. Thank you for your attention today, and I hope that this has been of interest to you. I'm Dr. Maurice Salama.